Welcome back to the IndeVets Happy Hour. I am your host, Dr. Andrew Heller, and I'm here with Dr. Marisa Brunetti, my co-host. And if you listened to our previous episode, you are here because this is part 2, where we discuss the clinical assessment portion of our application process. Let's dig in.
So a very important part of our candidate assessment process is sending a clinical assessment to all candidates after Andrew has a phone screen with them.
Right.
We have used this for almost 3 years. We think this is very important for a number of reasons. One, we don't work in hospitals with our doctors, and so we don't get to physically see them practicing. And secondly, most of our doctors are practicing by themselves as IndeVets. And so they have to have strong clinical expertise to be able to jump into any practice and work. Our IndeVets are trained and, themselves and by IndeVets to offer the gold standard, regardless of which practice they are working at. And so we thought we would delve a little bit into the clinical assessment for those of you out there who are veterinarians or practice managers, because we like to share our secrets about what we assess in our candidates and why we think it's important.
And when I give this assessment to candidates, I actually tell them it's not a difficult test. It's
not even a test.
It's not a test. It's really for us to be able to determine your level of detail, your attention to detail, I should say, your communication style, as well as your standards. I'd say those are really what we're looking for, because we realize that there are lots of ways to practice medicine, and there's no one answer to any of these questions.
Absolutely.
We have a question about what's your favorite type of insulin to use, right? And what's your process for communicating the disease state to potential, to your clients. And there's no right or wrong,
Right.
There are a lot of different ways to treat that. So let's start with some of the topics that you put in there, and why did you put those topics in there? So the first one is about the 4DX test. Why is that so important to you?
Number one, being an IndeVet, I've actually learned that 40X is like Kleenex, right? So the 40X, it's a brand name term, right?
True. Sorry.
No,
sorry, Antec.
Sorry, Flex 4. But I've learned a lot of different ways. Sorry, Acuplex. to test for 3 tick-borne diseases and heartworm disease. But up here, obviously, we're most used to calling it a 40X. And let me just break down that we have a number of questions first, and then we have an entire case study at the end. And just like Andrew said, there are no, quote, right answers. There's not one right answer. And this is an open book assessment. Veterinarians, we are notorious for looking things up and being very detailed. And I just want people to know that being a veterinarian is an open book profession.
Good point.
Right? I'm constantly looking things up. So
I think new grads don't recognize that. They
Right.
think they have to know everything all at once, and they get nervous. And,
Yeah.
as you become more seasoned, you start to realize it's okay to not know things. You just have to know where to find it.
Just to be clear, this in no way is, you just have to do it on the fly. So we picked a couple of questions for clinical assessment. One has to do with a controversial topic in veterinary medicine, which is, what do you do with a Lyme disease positive dog that's asymptomatic? No matter where we are, our hospitals and our vets are testing for at least heartworm disease every year as an annual test. And most of them are adding an additional tick-borne test to that. And in the South, you're looking at Anaplasma and Ehrlichia. And up here in the Mid-Atlantic and Northeastern states, you're looking at all 3 tick diseases. So we thought we would prompt people by asking them what they do if they get a positive on this test for a wellness exam.
And this is one of those questions that has multiple answers.
Right. And the reason it's so tough is because recently a consensus statement came out from internists about what to do with, Lyme positive dogs that are both symptomatic and asymptomatic. And we like to joke that it's a no consensus because there are still internists that treat no matter what with doxycycline. And then there are internists who do a lot of testing and workup. So we like this question because we want to see what your thought process is. Do you know what the specialists are recommending? Do you know what the gold standard is? But are you able to adapt?
And if your answer is different from somebody else's, why?
Exactly.
Not just what's your answer, but why is it your answer?
Yeah, you have to back that up, because you have to explain to clients why you're doing things, or else, they're not going to take your recommendations.
Right.
So we like to see that our doctors are recommending additional testing for all of those diseases if they come up positive. Obviously, heartworm is its own beast, so we won't jump into that. But for the tick diseases, are they checking a complete blood count for Anaplasma and Ehrlichia? Are they recommending a urinalysis with a urine protein creatinine ratio for Lyme positive dogs? Some practices are doing a C6 quant titer for Lyme positive dogs. Some practices are just treating. And so we're looking for detail as to why you would do something.
Yeah, I think it's a brilliant question, and it gives us, at the very least, a great starting point to start talking about a doctor's clinical standards. It's a really good open-ended question that gives us a lot more to talk about.
That's also a really good point, because it's like, what are our doctors doing to keep up with medicine? That consensus is pretty dense. And if you've read it, it shows that you're staying up with the times.
Also, this is a great spot where people who are more reserved and, getting them to open up, this is a great way to get them to start talking in the interview as well. This should get them excited. If they're good veterinarians that like what they do, they'll get excited about talking about these kinds of things.
Absolutely.
So another question that you put on there is about, when do you recommend yearly? Well, when do you? I always say it like
you
this.
Gave away the answer.
When do you recommend blood work on a wellness exam? At what age, and to which, in a dog and cat, in what circumstances do you recommend blood work?
Yeah,
on healthy pets.
On healthy pets, sure. I like to joke that the question is, when do you recommend annual blood work for wellness exams? And the answer is annually. But this question has many, many right answers, right? There are some people that start at specific age groups, right? 5 years old, 8 years old, when they're seniors, and why. And I think it shows, because we work in so many different hospitals, that each hospital has their own standard for when they're recommending blood work. And a lot of hospitals now are starting at that 15-month-old appointment. Our doctors have to be okay with recommending it at any time, at any age, and being able to explain why that's important.
We also have a question on there about your own particular euthanasia protocols and the discussion that you have with, pet parents around that situation. Especially as an IndeVet, you don't always have long-term relationships with these clients, right? They come in, it might be the first time you've ever met them, and they present for euthanasia. And it's a great topic. I think every veterinarian has to deal with euthanasia almost every day, really. Mm-hmm. So this is a really easy one. It's kind of like a softball question, I think. But again, it gets people talking and gets the juices flowing a little bit. And, I think we like to see that people aren't just injecting the vein with Euthasol and done, they're having the conversation and they're pre-medding with something. And I think even seeing what their pre-med is really important to us. I think, what you choose to use shows a lot about your standards as well.
I always say this to people, that euthanasia is the most important thing that we do as veterinarians, because we are the only doctor that gets to choose to help something die,
right.
And legally, to legally choose to help something die. And it's one of the greatest gifts that we have. And so it's not so much just the protocol, right? I agree. That's really important. Are dogs and cats sedated well enough? Are they not feeling any pain? Do they have an anti-anxiety on board? All of that is extremely important. But what are you saying to the owner? We want to make sure that our doctors are well-rounded. And if they've never met this person before, which is the most likely thing when you're an IndeVet, is how do you show your compassion? How do you show your empathy? What are you explaining to the client about what's going to happen during this euthanasia? Because that's really important. And then whether you put an IV catheter in first or you sedate first, why do you do that?
Right.
And what sort of success have you had?
I think some of the best answers we've ever gotten on this topic, like I said, it's a softball question, but when we interview people that have worked at like Lap of Love or one of these home hospice, home euthanasia companies, they are really good at this. Right. Mm-hmm. And they know all the tricks. So we've learned a lot from these interviews as well, just on some of these really great practices that people are putting in place.
That made me think, maybe we have over 150 of these clinical assessments now. Maybe we should just
248.
Oh, wow. Okay.
As of this
248 morning. Of these. I mean, what if we put together a consensus on euthanasia protocols, you know? It would be anonymous, obviously, but, you know, this is what the majority of people say. This is what the majority of people do. That's a decent N
It'd
number.
be an interesting project.
Yeah, sorry, we're just you were just having ideas
This
off the
would be
cuff.
a great like mentorship program,
Yeah.
like project, like something that, you know, to pass your mentorship program, you have to do something with this data for us.
Please do our job for us.
Yes.
No, I mean, on my first day as a veterinarian, my boss told me to go and euthanize 2 healthy shepherds that were like
Oh man.
8 years old. And I was like, no. Like your first euthanasia by yourself, it's just, oh, wow.
When I did my internship, I'll never forget like cat euthanasias. They'd always be like, pull up 3 and 3.
Yes, I still
3
use
and 3.
3 and 3.
And I still do it.
I do too.
Exactly like that. And sometimes I've seen people use like 1.5. Like they'll measure it out for cat. I'm like,
no way.
I don't know. Just do 3 and 3.
Yeah,
It's
3
just
and
so
3, man.
easy.
It's super easy. But yeah, and it's not on this list, but one of my favorite questions on our clinical assessment is about diabetes mellitus. And we talk about this a lot at IndeVets because, one, diabetes is so hard as a disease process to manage in animals, but it's even harder for IndeVets because we aren't out of practice all the time. So when we diagnose something with diabetes, we have to set the other doctor up for success. And so we want to know, are our doctors up to date with the standards? You know, AHA guidelines are excellent for diabetes mellitus. And so do they know the most common insulins that are used in both dogs and cats? And what are you talking to owners about? And how are you setting that next doctor up for success? When's the next recheck? When's the blood glucose curve? That is a pretty in-depth question. And we're so thankful that people actually take the time and write their conversations out.
I actually remember when we came up with that question, and one of the motivating factors for me for putting that question in was literally because I knew there was a lot of controversy about insulin prices right now, you know, with different governments coming in and insulin going up, insulin going down. And I was getting really confused, like which are the cheapest ones out there right now? Which are the ones that are in vogue? You know, which are the ones that most people are using and that work? Obviously, you know, we see a lot of the same answers again and again, you know, Vetsolin for dogs and Glargine for cats. It seemed to be, I'd say, probably the 2 most
except Glargine is very, very expensive. So.
Yeah, but it's really interesting to see people's answers, you know, even for my own personal.
Yeah, no, absolutely.
So the final portion of our clinical assessment is filling in an objective section of a SOAP. So you've provided a really great case.
And a subjective.
Oh, yeah, a subjective and an objective. Ross, fill that in. You provide a really great history on a young male cat that comes in with urinary issues, right? Everybody kind of knows where we're going with this, or you should. And, you know, you've left a lot of space on the SOAP for our candidates to actually fill in their normals, right? So you've given them the abnormals, they put those in, and then we say, fill in the rest with your normals. And why is that so important for you to assess people's normals?
We do give a thorough history, but one of the most important parts about being a veterinarian is asking the right questions. And so the first question on the case study is, what else would you ask this owner before, you know, making a decision?
Right. The technician's going to come in with the basics, right? And then you're going to go in and you're going to have to fill in the blanks.
So first they're prompted to write down what questions they would ask. And then for filling in their normals, it sounds like a trick question, but it actually isn't, because our doctors like provide a ton of detail in their medical records. And I think it's very important to write what you actually examined, because as IndeVets, not every clinic knows what your full exam looks like. So did you actually do a rectal? And if you did, you know, what did you feel? Because I may not feel a prostate in every male dog, but if I did, I'm going to write that I did, right? And so we want to know, did you use an otoscope? Did you use an ophthalmoscope? And so we're looking for a little bit more detail in the normal section. As we've seen with lots of our clients, they have their normals filled in appropriately.
Yeah, and people, you know, they become very complacent, and they sometimes where they work, they'll just put in NSF, no significant findings, or within normal limits. And, you know, when you're looking at the records every single day, that might be okay for you because you know what that means to you, right? When you're doing the follow-up. But our doctors are not always there to follow up, and people need to know, what is it that you actually looked at and saw? You know, I've been plenty of places where I see, you know, handwritten records and they don't say anything about the objective section. They just put in the abnormals, and I'll hear a murmur and I'll say, I don't see this on any previous objective section, but I also don't see that they said
Listen
there were
to
no
the heart.
murmurs. Yeah, like
Right.
listen to the heart. Nowhere does it say no murmurs ausculted, right?
Right.
So if you hear the murmur, is it new? Is it just that everybody knew about it already? So then it makes me feel like I have to ask the owner, like, have you ever heard that, your pet has a murmur? And they're like, no.
Right.
Or, oh yeah, I've known about that for years. They told me about that a long time ago. I'm like, okay, good. I'm glad.
Right.
So it's really important to put down your objectives.
And then obviously we ask, what sort of diagnostics would you want to do on this cat? And then we give them the results of some diagnostics, lateral radiograph, CBC chem, a urinalysis that was done in-house with a sediment. And then we ask them to put together their problem list and their differentials, and then based on everything, to do their most likely diagnosis.
Yeah, and I would say like at least 9 out of 10 people get this right. But every once in a while, we see that people treat these fluted young male cats, right? I shouldn't say fluted, lower urinary tract disease cats, right?
Or idiopathic cystitis. There's so many names.
FIC, whatever.
Yeah.
They treat them with antibiotics, and that's sort of our pet peeve. We really don't like to see that. It's not proper medicine, especially in today's day and age with antibiotic resistance and, just flagrantly using antibiotics
without a culture.
Without a culture, without proof, right?
Right.
I mean, your data on the question says no bacteria were seen.
Right.
Right.
And,
so why would you treat with antibiotics?
Right. And then the most important part, I think, is how are you describing this to the owner? What are you saying to the owner? And how are you treating this? We want to make sure that we're treating the cat's pain. There are still some people that don't. And I think that as we've learned more and more about pain in animals, it's a given. I like to think that, if I was having these signs and I was sick like this, I hope someone would give me an anti-inflammatory or a pain medication or one or the other. Yeah. So we're looking for that, but the most important is client communication, right? Because there's nothing worse than having a pet owner come back and say, he just had a UTI last time. Right. And that's it,
right.
And not learn about the stress and not learn about the other environmental modifications that you can do to help your cat.
Another reason for giving a clinical assessment for interviews, and this goes for all practice managers out there, all hiring people, it shows that you care about the quality, right? That you're not just looking to fill a spot with a warm body, like that you actually care, right? And I think the people that interview with us, they feel that we do care, and we do. We do. And I think this really is a great way of showing it, is that we care about the quality, we care about standards, we want people on our team that are going to live up to those standards and help elevate medicine. We're not looking for warm bodies. We're looking for people that agree with us when it comes to having high standards, right? That's a priority for them.
Yeah.
That
they came to IndeVets with high standards, and they want to continue to have them. And we learn so much from our doctors on a daily basis. It's amazing.
And I'm always surprised when we do see people trip up on these things. I have to commend you, Marisa. It's a great test, because when people do trip up, it actually exposes some of that lack of standards. And
thanks, Andrew.
Yeah, I think it works really well.
Thank you. But also, even if their questions aren't completely detailed enough, it also gives us something to look into during the interview process, and like a jumping off point to discuss more. And a lot of the times, people are busy. People have stuff to do. People forget to do things, and they'll say, I meant to write that, and this is what I normally say. And you're like, got it. I totally get it. So it is a good jumping off point.
So that brings us to the end of this podcast. And I just want to reiterate, we know it's not easy to find vets right now. We have trouble as well. So don't feel like you're doing something wrong. But we do hope that this podcast episode helps you understand how to really find the right people that are going to fit into your team. And we hope it makes it a little bit easier.
Thank you to Jillian again for joining us. It's been great to have a beer with you, Andrew, and I'm going to miss you next week.
And we're also going to have some show notes. So if anything we talked about, you're interested in looking into a little bit further, check out the show notes. And please subscribe.
And leave a review.
Yeah, please subscribe. Leave a review if you liked it. We are putting out an episode every 1st and 15th of the month, so look for them there at your favorite podcast place.
Peace out, IndeVets. I'm just kidding. Thanks, everyone.
Cheers.
Have a great day.